The opinions expressed on this program are solely those of the individual participants and do not necessarily reflect the views of either Spectrum Generations or Time Warner Cable. Mature Lifestyle is made possible by Knowlton Hewins Roberts Funeral Homes and Cremation Service. Our homes are warm and welcoming, and we take care of you and your family like we would our own. Call us anytime. We are here for you.
Hello, welcome to Mature Lifestyles. Spectrum Generation works so hard to bring programs that are so important to our neighborhoods, and today is certainly no exception. Who has not worried about medical issues and prescription drugs? We hope you're doing well, but I'm sure you have some questions, and who can answer them better than our extraordinary guest today? We have Nicole Petit, and she has a long title, but you're going to find that she's exciting because she is the Manager Marketplace Assister. And I want you to tell us more about that in just a moment. How do you help people with all the issues? You've done it for a long time, and you make things a little easier that are complicated. And then, of course, Jill Leach, she's also a licensed social worker, and she helps with the Aging and Disability Resource Program and probably 1,000 other things. One of the things I'd like to, first of all, for each of you to tell me a little about yourself. Tell me about you, Jill. How did you get into this work, and what do you find most challenging about it?
Well, I've worked for Spectrum Generations for 13 years as an aging and disability resource counselor and also what we call a SHIP counselor. SHIP stands for State Health Insurance Program.
Okay.
So offering information on all types of insurance, Medicare, MaineCare,
Right.
all of the additional insurances that go with Medicare. And I just started because I love working with seniors and their caregivers. It's very rewarding work. And I like to be able to explain things to people.
You're a teacher, really, aren't
yeah,
you?
yeah.
As well as caring about them, but there must be thousands of questions you field every day. How do people ask you
Yes.
those questions? By phone, or they come in, or?
All different ways. We have a helpline number. We have a 1-800 number, and so people can always call that number during the week. Our local centers, because we have centers in people's communities where we're all stationed. People can call their local center. They can email us.
So you make it as easy as
Yes.
possible. Give me a sample question that somebody might give you about a disability. What kinds of things do they want to know?
Well, some people call us and ask us, how do I apply for Social Security disability? Some people are already on disability. They're disabled and they're wondering, what are my benefits? When does Medicare kick in? How do I get health insurance if my Medicare hasn't kicked in yet? So all kinds of questions.
So you're constantly studying, aren't you, to keep
Yes.
up to date?
Yes.
Things change,
Yes.
don't they? And Nicole, you have an equally interesting background. Tell me a little bit about what you've been doing.
Well, what took me to the role that I'm in currently at Maine Medical Center with MaineHealth is I've been an advocate for the past 10 years for people with disabilities and children mostly. And what I decided was healthcare right now is, like you're saying, is always evolving and changing, especially
Yes.
with the Affordable Health Care Act. And the need for information is so huge among Mainers.
Everybody, right?
Everybody,
You're exactly right.
And so my role at Maine Medical Center is I work predominantly with inpatients who need help affording medications.
All right, because when you're in the hospital, inpatient, you're going to be going home, and
something.
it's so confusing, and that's
Yes.
what you help them with while they're in the hospital.
Yes, so it might be a new diagnosis that requires that they're taking insulin all of a sudden, or they haven't been able to take their insulin because they can't afford it because they're uninsured.
Right.
So we work to get people the resources necessary to keep them healthy and to live their lives.
Are there programs that help people who cannot afford their medication?
Yes, so there are prescription assistance programs through various pharmaceutical companies throughout the nation that assist people with that, and we kind of do the gritty legwork that's very frustrating for people.
Okay, so you help them know where's the right place to go to
Yes.
help with affording their prescription
Yes,
drugs.
yes, so we-
Because, I mean, we're always reading and hearing about people who don't take their medicines because they can't afford it, but that's not necessary, is it?
It isn't. With programs like this that are available, it also assists people who are underinsured or who have insurance.
I was going to say, if you have insurance, do you still qualify for some of this help?
Yes, and Medicare Part D is another population that we run into when they run into the donut hole.
Okay,
These
so
are
we're going
good.
to talk about that. Don't let me forget, please. So now, do you have to be an inpatient at Maine Med to use your services?
No, so
Tell me
I get
about that.
calls on a daily basis from people from Kittery to Caribou who might have heard about us through their doctor or through a friend, and someone gives them our number at MedAccess. They give us a call. We can do everything over the phone.
Oh,
So it really, I'm primarily working with inpatients, but we help people throughout the state.
and so you have a staff of people who are
We
ready
do.
to assist.
We do.
Well, that's a marvelous program. So you don't have to live in Portland. You don't have to be in the hospital.
Correct.
You can call up, and you can have insurance or not.
Correct, and then we do the research for you. We have offices throughout the state, but you don't.
You do?
We do. There's Cumberland, York, Lincoln, Kennebec, Waldo, and Oxford.
Okay.
If I already said Lincoln, I'm not sure, but
That's okay.
that's where people can walk into the office, but we can do everything just as effectively over the phone.
Okay, so, but they do have that option if they live near one of the sites.
Right.
And so, is there a web page? If people are computer savvy, they could find how to get in touch with you? Or?
Yes, and I believe even if, I think it will show it through this program,
Okay.
a place to access us online or the
Wonderful.
screening line if they prefer
And
the
one
phone.
thing I know is that Spectrum Generations is a wonderful resource for all the programs that are trying to do the same kind of work for
Right.
seniors and everybody else.
Right.
I want to come back to you before I forget. I know that this is a very important time in the lives of the people that you're trying to help make sure they have the best medical benefits possible. Tell me what's going on right now.
The Medicare annual enrollment period, it starts October 15th, goes to December 7th every year. And this is the time of year that Medicare beneficiaries can look at their coverage.
Say that again. It ends when?
December 7th.
All right, so now until December 7th,
Yes.
it's time to do a tune-up, really.
That's right.
Okay.
It's time to do a little inventory of what you have for coverage, specifically Medicare Part D prescription coverage and or your Medicare Advantage plan, if you have a Medicare Advantage plan. And ask yourself some questions. If you don't know what questions to ask, definitely contact Spectrum Generations and we will help you with that. But some of the questions to ask are, what is my monthly premium I'm paying? Is my plan's premium going up next year? Is it going down? It might be going down. That happens sometimes. Are all my drugs still covered for next year?
And does that change each year?
It does.
Or it could.
Plans can change their formularies or their list of covered drugs. So,
So if I'm in a plan and I have a new diagnosis and I need different drugs that might not be under my old plan,
right.
a new plan might take me?
Yes. So you certainly want to look at what are you taking for prescription drugs currently, and does your current plan cover those drugs? And what are you paying for copays? And then you can also look at other plans, the new, I shouldn't say new, but plans for 2015, to see if there is something that maybe has a better premium, a better price, better copays, or maybe covers a drug that you're taking that your plan isn't going to cover next year.
So no matter if you're already enrolled and you think things are great, it's
Yes.
important to take a look.
Yes, I've had
There's a
people call
window,
me.
right? There's this window. If you
Yes.
miss that window, you have to wait another year, is that correct?
That's right. You have to wait until the next annual enrollment
Okay,
period.
you were saying someone calls you in.
Well, I've had people call and say, do I really need to bother with this? I like my plan. The premium's good. I'm happy with it. I don't want to bother with this. I don't want to change. And, they can do that. If you do nothing, you simply stay with the same plan for next year. However, I have had people come into my office who just, they want to check it out. And they end up finding out that,
often surprised, aren't they?
wow, I can go with a plan that's $10 a month cheaper, or a better copayment, or, I didn't know my plan wasn't going to cover Lipitor next year. So those things happen, and unless people are looking at their coverage, they may not know it until January when they go to fill a prescription
wow.
at the pharmacy. And
And
it's not
just
covered.
as I asked Nicole, how do people know about you?
How
How do they get in
know
touch with
about
you?
us?
Everybody's going to want to be calling you every
Well, of course, we have a
minute.
website,
All right.
spectrumgenerations.org, and we do have our helpline number, our 1-800 helpline number. We have local centers, so we have centers in Somerset County, Kennebec County, Lincoln, Waldo, Knox, Saginaw County.
So if you're close to those and you like the face-to-face opportunity to
Yes.
talk, you can go there, but
Yes.
you're not limited. If you can't get there,
Nope.
you call.
Just call. We can
Is there a
talk with people
fee
over
for
the
your
phone.
service?
There isn't.
There isn't
There
a
is
fee.
not.
Wow.
So we can talk with folks about the coverage they have. We can do what we call a plan search. People can do this themselves, and a lot of people don't realize that they can compare plans themselves on the Medicare website.
You probably teach them how to do that as well.
We can do
if
that.
they want
We
to
have
know.
written instructions that we'll mail to people, or there's a link to them on our website. So people can actually get on the Medicare website, type in their prescriptions, and compare the plans themselves for next year. It's the same tool that we use. But if people are overwhelmed by that or don't use a computer.
A lot of people don't, right?
They don't, and they can just call us and make an appointment, and we will do all of that, as you said, legwork for them and show them what their options are for the following year.
What a resource, because your only goal is to help them get the best possible
Yes.
plan.
Yep.
It must be very rewarding to see that you can direct someone in a way that both saves money and gets them the drugs that they need.
It is. And people come in sometimes very anxious or overwhelmed because they just don't understand the coverage.
Well, thank you for taking care of some of those anxieties. Stay tuned. We'll be right back with more information that's important to you and your health.
Spectrum Generations. Live healthy. Live well. Get answers. Get connected. Spectrum Generations. Specializing in the art of aging.
Are you sick of being kicked out of your bedroom because you snore? Fed up with having to sleep on the couch every night? Then you need Pure Sleep, the #1 selling snoring solution in the world.
The first night he stopped snoring.
The second night it worked, and the third night, and the fourth night, and I was about in tears because it worked.
Invented by a dentist who snored, Pure Sleep is FDA cleared and proven safe and effective.
Pure Sleep started working the very first night.
It's small, it's comfortable.
You don't even know you have it in.
Pure Sleep is guaranteed to stop your snoring right away. To prove it, we'll let you try it for 30 days before you buy it. All you do is cover the shipping and handling. Plus, for a limited time, we'll give you a second Pure Sleep with travel case at no additional cost.
If we don't have the Pure Sleep, he's on the couch.
To try Pure Sleep and get a second Pure Sleep free, visit 3puresleep.com. That's 3puresleep.com or call 1-800-440-5161 right now.
Welcome back to Mature Lifestyles. We're learning so much today about access to health care and prescription drugs, and we have two experts, thank goodness. We have Nicole, we have Jill. And Nicole, you have described to me earlier some wonderful stories of people that you've been able to help through your program, MedAccess. Could you share with us some of those stories, or one at least?
Yes, I'll share my favorite.
All right.
I had met with someone in the past 2 years who was an inpatient at Maine Medical Center. He was working full-time, going to school, and had lost his insurance. And this person had Crohn's disease.
Ouch.
And he was on something that's called a Remicade infusion treatment, which without insurance can be quite a few $1,000s a month.
Couldn't afford that.
Could not afford it. So it landed him in the hospital. We were able to enroll him in a program that allowed him to get this treatment free for a year with the proper documentation. It's a very simple process to get people going. And what's really important to remember is we're always encouraging people, go to work, go to school, be a productive member of society. Well, that's really tough to do when you do not have health coverage or health insurance and everything that you need to live that life. So to be able to assist people to not deal with the inconvenience of being stuck in a hospital when you can be out working and going to school and making Maine a better place, quite frankly,
Not
because
to
you're
mention
contributing.
the cost to the healthcare system of being
Absolutely.
hospitalized. Not a good
Absolutely.
place.
So we were able to help him get back on track. And just to dovetail on that, the other thing that we do at MedAccess, we have a couple of certified assisters. I'm one of them who enrolls people with insurance through the marketplace. We can answer tons
Can you
of
tell us what
questions.
that means? You enroll people with insurance. What is the marketplace?
So when people hear about the Affordable Health Care Act, otherwise often referred to as Obamacare,
Right.
we
What does that really mean, though, to a person who has no insurance?
what it means is they now have the option to get enrolled in insurance as good as mine, and I work for one of the best health organizations
Right.
in the state.
And you can help people with that, because that's
Yes.
complicated too, isn't it?
It's very daunting. We're often dealing with people who have never had insurance, so the idea of, well, what is an enrollment period? What's a deductible? What is a monthly premium?
So you have to educate as well. You're both good teachers, I can see that.
Yes, and we deal directly with healthcare.gov, and we are constantly trying to get people the coverage that they need.
And do you find that people have been benefiting from that opportunity?
Absolutely. I had another example of a gentleman who was waiting for a transplant at the Leahy Clinic, and he didn't have real insurance. He had free care at the hospital. That is not insurance. It's charity care. It is not
Right.
insurance. The Leahy Clinic requires that you have health insurance. We were able to enroll him. He'd been working his entire life. He was 60-some years
But
old.
he didn't have insurance.
He did not have insurance. It was never offered to him. We were able to enroll him, get him some pretty big subsidies based on his income. He then was able to get into the Leahy Clinic. We see this in action. This is very real. This changes
Right.
people's lives and it saves their lives.
Looks like it makes a big difference to you as well. You
It
care
does.
about doing
It's-
that.
I think about it all day long. It makes me very happy.
And this is a word that we need to talk about, a pre-existing condition. Because he was sick ahead of time, they could not say no insurance for you. Is that correct?
Absolutely, and that is very close to my heart. I was diagnosed with type 1 diabetes in 1984. I was 9 years old. My dad, who was commissioner at the time, helped lobby this, that people with pre-existing conditions have every right to not be discriminated
Right.
against, and the Affordable Health Care Act also
does that.
ensures that.
So people should know that if they don't have insurance, there are opportunities, and just because you've had a disease, whether it's diabetes or anything else,
I had
they
somebody
can't
with a
say
triple
no.
threat. I had somebody with prostate cancer, stomach cancer, and I think he had diabetes. I mean,
Wow.
and I said, no problem. He wept. He said, are you sure? I've never been able.
Exactly. Well, that's a brand new concept, isn't it,
Yes.
for everybody? Well, that's
Yes.
wonderful. I'm going to come back to you again because I don't want to forget. A donut hole is not something we eat. A donut hole sounds good, but it's horrible. It has to do with prescription drugs. And could you tell us a little bit about what it is, and then what you can do about it?
Well, when you have a Medicare Part D prescription plan, the donut hole or the coverage gap is when you and your plan together have paid about $3,000 out of your pocket, you and the plan, I should say. And you fall into what we call the donut hole. And at that point, instead of just paying a co-payment for your drugs
You're
at
on
the
your own,
drugstore,
aren't you?
well, you used to be. When Medicare Part D first started, you were on your own, and you just paid full
So
price
that's
for
no
the
longer the
drug.
case. Well, that's good news.
No, and that was one of the things that came out of the Affordable Care Act as well.
Good.
Was that the donut hole or the coverage gap is going to be eliminated by
Gradually.
Yes, gradually. So now it's about 45% that you pay out of your own pocket, but still that can be expensive for
Depending
folks
on your illness,
to pay
right.
almost half the price
Drugs
of the
can be
drug.
extraordinarily expensive, can't
Yes,
they?
yes. So when people hit that coverage gap, we get those calls and they say, how come instead of paying a $20 copay, I went to the drugstore and it costs $150. What am I going to do? I can't afford that.
Right. What do they do?
Well, we talk with them about, first of all, seeing if there are any benefits programs that can help them. The low-income subsidy with Medicare Part D, they can apply for that anytime throughout the year, and so we would first assess them for that. There are some copay assistance programs that help during the coverage gap. We would certainly refer them to MedAccess or patient assistance programs that can help them in that donut hole.
Right.
So, and also speaking with their doctor about what are their options. Are there generic drugs for what they're taking that may be less expensive or less expensive alternatives? So it's also having a conversation with their doctor just letting them know how expensive their prescriptions are. And
I think
that
we
maybe they
often
can't
don't have
afford
any
them.
idea, do we, how expensive our medications are, because you usually
No.
walk in, you're insured, and they hand you your packet, you may pay
Yep.
$10, but all of a
Yes.
sudden, if you are in that period, you find the real cost is just beyond your means in many cases, right?
Yes, things like inhalers
Ah.
can be, you know, $400, $500, $600 each. A lot of people don't know that, so they're paying a copay with their Medicare D plan of $30 or $40, which is quite expensive
Anyway, because they're on fixed incomes most of the
Yes.
time.
Yes, and then they hit that donut hole, and all of a sudden they're paying about half of the full price, so it could be $300. Well, that's 10 times their copay, what they've been
Exactly.
paying, and it's
And
a
you,
hardship.
you talked about working with some of the pharmaceutical companies sometimes, does that, and I assume that you would do that together if she called you up and she's
Absolutely.
exhausted everything that she knows about.
And there are some programs that will consider people, because people with Medicare are considered, well, they are insured, so the
Right.
farm companies say no thanks. But
Right.
if they have Part D, they will be considered often on an exception basis because
Okay.
of the donut hole. So
Yes.
absolutely keep referring them.
Yeah.
Okay, well, it's nice to know that you two are working together, and I'm not surprised at all, because your number one goal is to make sure that people have access to health care and prescription drugs. What else do you think seniors should know in particular? We know the time period, is the clock is ticking now. What if you've never been on, it's your first year to apply? You help people with that as well.
Yes, yeah, we help all the area agencies on aging across the state help
They're
Medicare
everywhere, they're
beneficiaries.
statewide, aren't they?
Yes,
Area
yes.
agencies on aging,
There
okay.
are 5 of them, and we're across the state, and we all give information on Medicare in general and benefits. So folks can call us if they're going on Medicare soon. We do a lot of, we call them Medicare 101 clinics.
I think that's so important. I remember when it was first time for me to do that, it was overwhelming.
It is.
And even though I can read and I'm trained as a lawyer, just reading all of that, it was, and my husband, we spent hours and hours. We weren't smart enough to call you to find out. I'm hoping that other people watching this show know that there's a resource out there, so don't fret about it. Get the information and make a good decision. And also, we're talking today about you can change it
Yes.
if you need to every
right.
year.
That's
So people, is the same window of time now when you get in for the first time as when you have your tune-up, if you will?
Well, when you
Or not.
first get Medicare, either when you turn 65 or if you've been on Social Security disability for a 24-month period, that is your initial enrollment period. And there's a 7-month window around that.
All right. And if you had some major change of circumstances, you can probably revisit those things,
Yes,
right? Like
there
a-
are special enrollment
Right.
periods where people can get coverage if they've lost coverage, if they've moved to Maine from another state.
Exactly.
And their coverage doesn't work in Maine, that opens up a special enrollment for them to be able to get coverage. So we have all that information for folks if they're trying to sort that out. And also for caregivers, if they're trying to sort that out for aging parents who may not be able to do it for themselves.
And a lot of caregivers do help with that
Yes,
decision, don't they?
absolutely. Yes.
Any last minute, really important thing you want to make sure the audience goes away with? We know to call you, we know that.
One thing I would remember, you brought up different medications, $4 meds at Hannaford. We've run into situations where Lipitor might be $70 at one pharmacy and $4 at another if you get the generic.
Really?
So, and I only know that because I talk to so many different people. So that's just a reminder for people to give us a call.
All right, so we better be good shoppers as well as good healthcare consumers. Please stay tuned and come back for a very important announcement.
If I got to go to college, oh my goodness. I like discovering new things. You get to see what works for you and what doesn't. That helps you evolve as a person. You get to make like a supernova of skill or talent or whatever it is. I've always wanted to go to college. I just feel like that's my destiny. My name is Queen, and I am your dividend.
You're watching Time Warner Cable Community.
Welcome back to Mature Lifestyle. Spectrum Generations has an exciting service here that we want to talk about. It's called Care Management, and I have two people who can help us understand it. I have Melissa and I have Mary, and I understand that you know a lot about this service, and it seems like a very good one to know about. Would you share your information with us?
Sure. Spectrum Generations is opening their new care management program, which is a fee-for-service program where we're going to be integrating care services with individuals and families, going into their home and assessing where they are, and determining what the best action plan for them would be, whether it's getting in-home services set up or having meals delivered, somebody that may need to go to a nursing home or assisted living facility.
Right, because it's a pretty tough time. If you're a caregiver or if you're a family member, how do we know? And you help figure it out. You look at the big picture and see what all the services are. Can you give me an example of somebody that has benefited from this great approach?
Well, recently in my own personal life, I've had a grandfather that was declining from dementia, Alzheimer's disease, and my grandmother was having a hard time caring for him, and went in, and I would be talking to her, and she'd be telling me he had a hard time dressing himself, and she was having a hard time helping him get dressed because she was having a difficult time with it. They were kind of in an assisted living facility before, but he just really was wandering, and she was having a very hard time making a decision. So as care management, the same thing goes in that situation where we kind of give them an opinion as to what their next step should be.
It's their decision, but you can look at it more objectively.
Right. So in our care management program, it's really the only program that's actually going to give you an opinion of what your next step should be.
Oh, wonderful.
Instead of listing out, well, you could go to assisted living or you could go to a nursing home.
Here's what we think you should do.
We think that you're going to benefit
I'm going to ask Mary
best.
how that works.
How it works is a consumer calls or a caregiver calls into Spectrum Generations, and we do an inquiry, and they talk to a care manager, Melissa or myself, and we have a conversation. And we kind of drill down to their needs, and from that conversation, we set up an appointment at their home to meet with the consumer or the caregiver. And we do a very comprehensive full assessment. And what that includes is we look at the activities of daily living, bathing, dressing, grooming, how they eat, their environment, safety, and all that gets collected onto our forms. And then from there, we make an action plan that looks at the person's strengths and also where the need might be. And from there, we make our recommendations.
Now, earlier, Melissa said there is a fee for service. What does that mean? Is there a cost to this?
Correct. There is a cost to that, which is discussed when we had that conversation initially.
And so should people who feel like they don't have enough money be a little concerned about calling you up, or is it a sliding scale kind of thing? How does that work?
At the present time, it's not a sliding scale.
But it's a modest fee, is it?
I would say it's a modest fee. The assessment takes approximately 4 hours.
Okay. Oh my, it's a very thorough, isn't
comprehensive
it? That makes the
assessment
family feel wonderful, I'm sure.
It's very holistic, I would say.
And it is, you do have, as they would say, experts assessing. So it's, a clinical social worker is myself and an RN. So you're gonna have both aspects of that addressed. Both your mental and your physical needs are gonna be addressed to determine what the best action plan is. There are different sets of fees for different services and what we're providing. So we ask that people who are interested just to give us a call. Don't let the fee word scare you.
And find
we
out.
just want to be open to
And
the
then
fact.
I'm going to thank you both, and care management is extraordinarily important. Thank you for joining us on Mature Lifestyles with Spectrum Generations.
Thank you, Libby.
Thank you.